So our webinar today is called So You Want to Write a Bill, Training Youth Leaders in Legislative Advocacy. And this is part of our youth leadership series with the National Empowerment Center. Our presenter today is Saanvi Arora, who I'll introduce in just a minute. My name is Shira Collings, and I'll be the moderator today. I'm the grant coordinator for the National Empowerment Center. This webinar was developed in part under grant number SM082648 from the Substance Abuse and Mental Health Services Administration, SAMHSA, the U.S. Department of Health and Human Services. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. And this webinar will be recorded. The recording will be posted to the National Empowerment website at power2u.org, and that is the number 2, the letter U. And closed captioning is available. You can click on the CC or more to view closed captioning, and you can also view the entire transcript of the meeting by clicking on Show Transcript. At the end of the webinar, there will be a Q&A session. You are invited to ask questions at any time through the chat function, and we'll do our best to answer all questions. If we do not answer your question, you're welcome to email us at info4, that's the number 4, at power2u.org. That's the number 2, the letter U, and we will do our best to get back to you. And you're also welcome to make comments using the chat function. So I'll now introduce our presenter. Saanvi Arora is a leading youth advocate and policy expert, as well as the executive director of the Youth Power Project, a youth-led organization that empowers young people under 25 to inform local, state, and federal policymaking based on their own experiences and has introduced and passed over a dozen state and federal policies. She is focused on understanding the intersection between public policy, technology, and community attitudes toward health, and published a paper in the Institute for Electrical and Electronics Engineers in 2020 regarding the potential for the Internet of Medical Things to reduce costs and barriers associated with healthcare. She has also been recognized for her contributions to key policies improving access to reproductive, sexual, and mental health care for young people, and has written and/or advised numerous state and federal policies and initiatives on those subject matters. Recently, she drove the youth-led effort to write, introduce, and pass S. Res 769, declaring an adolescent mental health emergency and advancing experience-informed recommendations for state and local actors to respond unanimously through the U.S. Senate. Overall, she is invested in bridging gaps between successful policymaking and younger generations by advocating for cultural, educational, and institutional improvements that encourage youth civic engagement and promote free expression. She is currently an undergraduate at UC Berkeley, completing simultaneous bachelor's degrees in computer science and legal studies with a minor in public policy. Thank you so much for being here, everyone, and Saanvi for presenting this webinar for us, and I'll now turn it over to you.
Yeah, thank you so much for having me, and I'm super excited to share a little bit more about engaging young people in policymaking and kind of providing a little bit of a training also on the general state legislative process and opportunities across different state legislatures to engage young people in policy design. But before I know, I think we mentioned a little bit about the Youth Power Project, and I can provide a little bit more background on some of the work that we've done and different case studies that through our work that have shown to be pretty helpful in understanding programs that empower young people to be co-creators and to co-govern behavioral health systems. But as mentioned before, YPP, we focus on breaking down barriers between lawmakers and young people, having young people with adverse health experiences to transform their lived experience into state and federal policy work. So a lot of this involves really situating the needs that, or that they have recognized within different civic institutions, and then figuring out how to best position them and platform their voice to be one, obviously incredibly transformative in shaping attitudes around care and utilizing peers as messengers for cultivating trust where there currently isn't between young people and healthcare and broadly governmental institutions. And second, this good for policymaking. It's good for policymakers to be able to hear from young people directly, the people that are using their services, and craft effective policy in the now instead of waiting, um, you know, and reacting to harms after they occur. That said, our strategy is pretty diverse and fluid. It really focuses on figuring out ways that we can meet young people in the communities that they're in and leverage the communities and organizations that already trust to resource them with the ability to make change. So we empower young people to draft and reform legislation in Congress and state legislatures, and empower them with the knowledge and the education to navigate those systems in an effective way. Since our focus has been incredibly oriented around lived experience and storytelling, we've been able to do that in a very interesting bipartisan fashion, getting legislation unanimously adopted through the US Senate, working in states like California, where there's like strong political majorities, but also being able to take this model and work in states like Louisiana or across the country, across various diverse political ideologies, centering the voices of young people has always been something that we find to be a bridge builder um, between different political sides of the equation. And obviously, this involves a lot of coalescing, informing the public narrative, and then empowering authentic storytelling in a way that isn't just facing lawmakers, but also facing other members of the community. Oftentimes, like policy requires solving for community needs, and so the role of individuals can really, especially peers, can be really helpful in bringing large communities together to address systemic issues, and that's where state and federal policy is oftentimes also most effective. So that being said, I think that what we've seen, especially and heard from young people across the country, is that mental health systems across schools, communities, and clinical settings obviously are fundamental to improving young people's mental health literacy, resiliency, and their comfort in seeking help. But one, there's very limited integration across all three of these settings. And there's limited integration between schools and communities, and there's limited integration between communities and clinical settings and schools and clinical settings, like all these communities while they or spaces while they work together to inform a young person's mental health outlook and mental health condition, they oftentimes don't work together. And so there's a lot of gaps that occur in that regard. And also, a lot of this persists because many existing programs, especially programs that are created within schools, were designed as temporary interventions for students or young people's needs, but obviously evolving youth demographics and the complex presentations of mental health needs requires more comprehensive, experience-driven, and culturally responsive support services. So schools, while you might not traditionally think of them as healthcare providers, are often some of the first places where young people encounter health education or health literacy, or are first experiencing mental health concern. But schools, obviously weren't designed for that purpose. They weren't designed to be a point of first entry for healthcare. And so while they might be able to be effective at triaging certain issues, they currently don't have the infrastructure to provide the long-term support that oftentimes students need. But education is oftentimes one of the most ubiquitous ways in which you can reach all young people, just given, especially in the United States, given how, the compulsory nature of education. So a lot of those things, those factors and characteristics really intersect in terms of shaping a young person's outlook on mental health support, um, and obviously the coordination of their care. From what we've seen, effective systems obviously must provide that coordinated care across these different settings, from early intervention in schools and community outreach to clinical treatment and peer support. And there must be, more done to ensure that there's an integration between all of these systems that ensures their seamless transition and holistic support. Um, Obviously, over time, that's like we've seen significant changes in how young people perceive and respond to their mental health challenges. So, another confounding issue that we see apart from just the siloing of these different uh, fields is also just how young people themselves are responding to mental health conversations in their communities, how they're receiving the idea of seeking care. And we also know that like across several demographics of young people, and it's obviously this is not just an issue that's isolated to age, there is significant distrust between young people and the healthcare system. You know, if schools, a lot of young people remember like K through 12 education as a source of trauma for them when it comes to when it came to expressing their mental health needs. And obviously an experience like that will make you much less likely to want to seek support from your school ever again or seek healthcare ever again. And so while we are doing a really good job in terms of moving the needle forward and combating some of the gaps in different fields that support young people, there's still a strong memory amongst a lot of young people of distrust and the lack of support from those institutions. And so while we have seen an increase in investment in a lot of different kinds of mental health services, we might not see a matching increase in utilization. And that doesn't necessarily indicate that people and young people don't need help. It just means that they are finding that help in other ways, and that they might not trust the top-down services that are being offered to them. And I think a really great way to consider this is 988. Obviously, 988 is an incredible program. It's been transformative in handing not just young people, but communities across the country the ability to seek emergency support upon recognizing that they're in need, and schools have done a great job of advertising 988. A lot of states have put it on the back of student IDs, and obviously, like the integration between 988 and 911 has been really important in increasing the awareness of this issue. But obviously, there have been also at the same time significant gaps in the design of 988 that, had they been rectified or preempted, would have made the program a lot more um, uh, successful amongst younger demographics, and also have created that initial buy-in. So to kind of look at that as a helpful use case, some of the things that we've heard, and that I know that have been rectified as the program has been iterated on over the last 5 years have been obviously one, what if I share information that would force me to open a legal report against someone who harmed me? This is a concern that comes up amongst a lot of students with 988. They're worried that if they call 988, it's like they're calling 911 and they're reporting. If they report on, the same way that we see mandated reporting, there being a lot of fear among students for reporting harm or reporting sensitive issues to their teachers. They feel the same way about 988. Um, they might remark that, hey, I need support near me, but I'll probably receive support from someone far away who won't be able to help me anyway. This actually has shown to be a pretty significant deterrent in young people calling for help, because sometimes they want to talk to someone who's in their community or local to them. Obviously, this is an issue that has been corrected by SAMHSA, and also just in general, with geolocation being used more than, or the shift towards geolocation in the deployment of these services. But that's an issue that comes up a lot. A lot of young people will say, "Hey, I don't think I'm facing enough of an emergency to make a call." Or they'll say that, "Hey, the person who's answering the phone might not understand my specific situation." All of these gaps are gaps that maybe are more misconceptions than actual gaps in the program, right? Like, if you bring these up to program administrators, they might say, "Hey, no, we looked at this issue already, and this is what we did to fix it." But amongst young people, the attitude might still, um, focus on, hey, like these are still outstanding concerns. I don't really know where to access information. And honestly, like there are spaces that I'm already turning to that I honestly just trust more in my community. So obviously, like this begs the question of awareness versus trust. So young people oftentimes know that services exist, but they just don't trust them enough to engage meaningfully. So the challenge when it comes to effective mental health policy and service delivery isn't just about access, but also about creating systems that have buy-in from the community, that youth believe will actually understand and respond to their needs. So that being said, obviously there's a few different reasons why like distrust in government, distrust in healthcare might spill over and impact this. One, like government, healthcare, and education institutions just seem physically and metaphorically far away. Like you're much more likely to trust something that you had a hand in building, or that you can kind of understand, where it came about. With government and healthcare institutions, oftentimes they just feel physically and metaphorically distant from you. And for a lot of young people, they're like, oh, this is like a big, scary like system. Why I don't know if I can engage in it with a full agency. And ultimately, like the opportunities for their engagement remain unclear and intimidating. If they face harm, a lot of the times they might not report it, because not just because they don't want to report it, but because the institution is so large and complex, they don't understand how their report will be replied to meaningfully or what exactly they're getting themselves into, what that process looks like. And obviously that dilutes enthusiasm, especially with harm reduction and mental health. Like those with certain identities or experiences might feel disproportionately targeted for reporting, for providing feedback, for speaking out about concerns that they might have. And also the lack of communication around current events also harms trust. A lot of young people, like I mentioned before, their first experience with mental health care is in education systems. But oftentimes education systems remain really silent about current events. They remain silent about trauma that they might experience in the community, that folks might experience in the community, loss that they might experience in the community. And what we found is that for young people, for students, like they find it particularly um, like they don't resonate with this idea that their school should be silent about those issues. They think that that silence actually demonstrates an attitude of a stigmatizing attitude towards mental health versus um, a helpful attitude towards mental health, especially as it relates to suicide on college and K-12 campuses. I mean, universities or schools not being proactive in sending out messaging or talking or not creating space for young people to come together and talk about it might create this. Obviously, I know there's other things that kind of come into play there, whether a school can do that, but a lot of the times the lack of any kind of presence of the campus on those issues can deter students from feeling that their campus truly cares about their mental health and well-being. And finally, like we know that young people turn to communities, not government or education systems for support. We know that young people are much more likely to turn to their friends. They're much more likely to turn to their coaches. They might be more likely to turn to faith-based leaders, and that's not a bad thing. It just shows that a lot of the times when we talk about access and delivery and situating or creating buy-in in communities, we have to reach young people. We have to reach those communities and spaces that they're already turning to trust and create buy-in there before trying to mold people's experiences into existing programs. So that being said, there obviously are limited bidirectional feedback streams between providers and young people also receiving care. So beyond just like the systemic reception of mental health services, the young people also sometimes find it hard to voice their concerns and and actually have a voice in the actual care that they're receiving. And obviously, this can take the form of your as a young person, your ability to provide feedback to your like your therapist, your individual provider, or also provide feedback to your school, to provide feedback to a system that is dictating dictating the services that you're receiving. And this has been proliferated by historical distrust between impacted populations and healthcare institutions. Generally, like informational asymmetries between young people and service providers, and also like limited or inconsistent engagement of young people in the actual program design and marketing, which I think is something that I'll talk about later. Is like a really great way to get young people engaged. Um, so that being said, I know I talked at the beginning, or like the focus of the presentation is really on effective policy design and co-governance with youth. But obviously, I wanted to provide this like, kind of framework around trust and how young people receive services as a way to talk about three dimensions. One being service design and policy making, the second being outreach and engagement, and the third being funding and infrastructure, all of which really work together to shape how young people receive policy and services alike. Um, Obviously, generally, I think probably preaching to the choir, but viewing mental health policy holistically, acknowledging that mental health and physical well-being are intertwined, and providing both early intervention and crisis response support is really critical to like understanding the different ways in which there's so many different ways that young people are receiving mental health care, but also there's so many different factors and determinants of their mental well-being, as with any community. And also understanding the relationship between housing, food security, their academic outcomes, economic safety, identity, and immigration status is really important for crafting good policy that really ensures that we're looking at that systems integration issue that I brought up at the beginning. And finally, addressing the attitudinal, economic, social, and familial barriers to seeking mental health care. So, in terms of turning stories into law through career and advocacy, this is kind of um, a mini version of like the training that I give to like youth advocates, but I think it's helpful to just provide to people in general so they can understand like the really important role that like young people can play in drafting law. Um, Obviously, like issues pertaining to health and well-being usually pervade most people's daily lives, and like who better to talk to about youth healthcare than young people who are experiencing their own health and well-being in their day-to-day. And many of the stories that like obviously young people are sharing with one another are incredibly similar and do identify trends that can be mitigated by system-wide institutional and or public policy changes. And one example I want to provide of this is my own story and my own experience. I first got involved in like policy work when I was 15 years old, and I genuinely in that age had no idea what anything was. I couldn't even name what I was doing as policy work. I was clueless. I was very civically disengaged. But I didn't get involved because I wanted to be civically engaged. I got involved because I saw a problem in my community. But yeah, when I was 15, I also my really close friends to suicide, and it was a really difficult thing for me to go through. Obviously, it's difficult for anybody to go through a loss like that, but in my community, talking about like issues like suicide and mental health care were just it was just very taboo. Like no one really discussed it. And so I remember my first ever like real form of advocacy really being to my own family to like talk to them about my own mental health experience and like just what I was going through in that moment and how upset I was that like people weren't talking about, you know, like um, my friend losing their life. And that's oftentimes one of the first experiences of advocacy that most young people have is in their own community. It's to their own parents, it's to their own family members or their own friends, standing up for themselves, and what they believe in. And after like I lost my friend, I started volunteering for a crisis line in my area. It was like a youth crisis line. So I met a bunch of other young people who were also passionate about mental health. And I met this one other guy who was my age, and he and I were talking about how in the state of California, which is where I'm from, there's basically no excuse absences for there were no excuse absences for mental health, and how difficult it was during the pandemic for students to keep up with school, given the extensive amounts of burnout that they were facing, and how a lot of students were like dropping out of school or had facing chronic absenteeism because of mental health care and being punished, or because of mental health issues and being punished for just a very organic and human response to like the state of the world. And so we talked about how like across all schools in California, this is like a really, really big issue. And he was like, you know what? Like, I think we can change that. I think we can go to the state legislature and change that. And I was like, dude, like, you're actually not. This is delusional. I told him that. I remember I was like, this is like, who do you think you are? You can't even vote. Like, what do you mean you're going to go to like the state legislature and like tell them to change this? Like, I don't even know how to get there. And he was like, trust me. Like, he just like, I just kind of just tried our hand at seeing what we could do. And we stalked all of these, like, I'm not endorsing this, but we stalked all these lawmakers, staff members on LinkedIn and like found their emails, and we're a little bit weird, but I guess it was our democratic mandate. And we emailed them this proposal, this idea that we had for like changing like the California education code and making it more so that schools weren't punished for offering excused absences, and changing some of the funding formulas to accommodate for this. And we sent that over, and I got like a member of the state legislature picked up the bill and introduced it as legislation, and it passed within 9 months. And so by the time like over this like full period, I just felt I was like, wow, like I really caught the bug. I was like, damn, I never would have understood or really like thought of like policy as like a route for me to really engage with. But the more surprising thing was that we thought this was such a common sense solution. We were going to lawmakers. We were like in high school. We were like, this is everybody talks about this, and they were like, "What? We've never heard about this." And it's like, obviously, you've never heard about this. None of you are in high school. Like you're not in these spaces with peers. You're not hearing the gaps directly. And so I realized that there's a lot of work that needs to be done to surface like the issues that like day to day peers are talking about to lawmakers, and there's a lot of common sense policy that can come out of that really can move a lot of mountains. So I started to get very involved in like legislative work, and um, obviously like working in spaces like working in a crisis line or working with other young people who had mental health experiences. Like you talk about things and you relate to peers in a way that can really cultivate an understanding of systemic barriers to healthcare access. And so for youth, so with that, like we started the Youth Power Project to focus on empowering young people to do that, to create those spaces that surface the issues that they care most about, whether that's mental health. So that being said, like what we tell young people to do when we train them now is like we're like, hey, just have conversations, and you talk to your community, and you hear them out, and it doesn't have to stop at just identifying what the need is. You can also work with young people to identify a solution. It turns out young people are very good at placing blame on people that they think are doing things wrong. And that's not to say that like youth advocacy needs to be adversarial. It's just that, you can ask these questions and inspire some really important civic dialogue. But like extract or like abstracting beyond just like the immediate harm that a community might face, to then obviously be the like actor who might be able to best solve that is what we like really prompt a lot of young people to do. So for young people, we notice that common stakeholders can be teachers and staff, or care practitioners, school districts, university administration, the state and federal government. So um, for the purpose of this presentation, focusing on state and federal policymaking, we can really we really talk to young people about understanding the actors and institutions that have the authority to change the law or implement policies related to our identified issues. So I'm giving them the tools to understand the budget process in the state legislature or the federal budget process, the role that schools have in implementing different kinds of programs, the mandate that's given to these different actors in shaping the way they might experience healthcare. And you can pick up on it pretty fast because you experience it. It's kind of it's easier to understand. Um, and after we kind of go through that a solution exercise, we explore, how does a bill really become a law? And it's pretty straightforward. As most state legislatures and Congress, have very similar procedures, very similar methodologies for engaging or for passing legislation, and most of them also have pretty similar methodologies for communities to provide that input and directly go and write laws themselves. And I think the biggest thing that we have to demystify for young people in that regard is helping them understand that it's not abnormal for lawmakers to not write their own bills. And it's actually incredibly normal for lawmakers to rely on communities, rely on groups in their district to shape the work that they do. And that's part of their job description, is to listen to them. So it kind of helps combat this imposter syndrome that we've noticed amongst young people, automatically disenfranchising themselves in the legislative process by mere virtue that they don't have a master's in public policy and aren't supposedly an expert. Um, but rather empowering them to know that their lived experience is expertise, and that there are, within the actual procedure, there are so many ways for them to be involved. So obviously this is a pretty quick summary or just a little graphic of the US legislative process. You have two chambers, bills introduced. Both chambers have to pass the same version of the bill, and it can go through different committees. And in the committee process, there's opportunities for you to testify, for you to do a lot of advocacy work and raise public awareness to push people to vote on the bill. But also that your legislative advocacy can be a starting point for a broader movement as well. It doesn't have to end with just that one policy, but a good policy is a great starting point for creating public education around an issue. And so that's kind of how we like to train young people in the legislative process. And then obviously, I love to talk about the Senate resolution that we wrote and passed through the U.S. Senate. So showing young people that their work doesn't have to oftentimes their work won't be partisan. It will be bipartisan. It's and the importance of integrity and storytelling in creating bipartisan points of union and unity is very, very possible, especially in the mental health context. It's very hard to politicize a young person, hopefully, a young person who is experiencing mental health conditions. And luckily, mental health has been more of a bipartisan issue in general over the last 10 years. And I just put through a random state in, but this is one of the states that we've trained young people in. So showing them that across different state legislatures, the process is very similar. In the state of Maryland, for example, it looks very similar to Congress, looks very similar to the state of California. And there are obviously differences between the different legislative processes across the state, but understanding the general methodology and being able to deliver that to young people is really helpful, because it creates a model for how they can engage in these ways and iterate across different policy measures as well. We also train a lot of young people to write the language themselves. Obviously, most language of the law gets vetted by lawyers. We're not expecting young people to be writing in the full legalese, but we do train them on how to read the law code and how to identify the best place for their proposed policy change in the law. And this is kind of what we tell them. We tell them that precedent is your best friend. And sometimes with writing laws, writing policies, you want to maybe plagiarize a little bit. If you've seen a policy being successful at the local level, figuring out a way to model that language at the state level. Or if you've seen a policy be successful in another state, how do you bring that to your own area? It's okay to copy that. It's okay to use that as a framework. And also like teaching them how to even like search for existing legislation, teaching them that like every state has an open source, like their law code is publicly accessible, and that like you can look for legislation that has been pursued in different states. And you can do that research and you can build on that and you can spin it and make it your own. And we also don't tell we tell them not to be afraid to write the bill language themselves. And that's actually a really good practice when you're going to lawmakers' offices to have your own version of the language of the law that you want to see. Because one, it like creates an effective starting point that you started. And you're not like limited to any other purported limitations that someone might place on you because you know what you're looking for within the language of the law. But also like it's okay if it's wrong and you go to them with something that's a little bit like of a rough draft because all lawmakers are going to run their final legislative language by council in the state legislature or even federally to make sure that they're not going to get sued for pursuing a specific kind of bill, and to make sure that's written correctly. So like ensuring that like young people can get their voice in early in that process ensures that we're really maximizing the use of their time, the use of their voice and their experience to craft like the policy that they really want to see. And this is like literally it's like obviously like once this is honestly the easier part of it, once you kind of get past like the um demystifying some of the more nitty-gritty policy details, teaching them how to pitch their policies to different lawmakers, teaching them how to um like like they can do it as an individual. They don't need to be a part of a formal organization, but like the benefits of working with nonprofits, working with other advocates in their area, and how to build coalitions and build networks so that they still have ownership over their idea, but they have like the institutional backing to be able to pursue something in the legislature if they need it. And we also teach them on how to like find how to research legislators, research who they want to carry their legislation forward, and how to talk to them, rehearsing an elevator pitch, anticipating these common FAQs, and coming prepared with details. But really, what this boils down to for us is showing them that like a lot of this can originate out of their own story and experience, and that when you are like talking about policy ideas from a place of vulnerability, you can really treat it as a conversation with another person. You don't have to like reduce or perform in the way that you uh, deliver something, and you can be strategically authentic in um, in in your delivery of your pitch, to feel in a way that's empowering to you, but also effective in getting someone to pitch or pick up the bill. And we provide them with obviously help them understand what they're getting into with each meeting, like help them understand how to introduce themselves, like what a common meeting with the legislative staffer aide might look like, how to do follow-ups. We teach them how to have a very concrete ask in every meeting. It's really important to end every meeting with um like with a concrete ask. It's great to talk about an issue and a solution that you have, but if you don't end the meeting with saying, hey, can you introduce this, can you sign this, can you co-sponsor this? Will you vote yes on this? Like, you want to make sure that like every time you meet with a lawmaker or their staff, that there's something tangible coming out of it. We also teach them how to do that kind of follow up and due diligence. Yeah. Tips and tricks generally, like we work with all of our young people to connect them with relevant stakeholders. So many policy ideas that young people have obviously impact and spill over to communities beyond just youth. Being been thinking about like our youth absences legislation, like the importance of us connecting with school districts to understand why they hadn't already implemented it, helped us anticipate like the very likely pitfall that we would have faced in the legislature around like funding. If schools in California are funded based on attendance rates, are we punishing schools that have fewer resources to address mental health crises, so therefore they have higher absenteeism? Like kind of looking at that kind of question is really important, and we wouldn't have really been able to get to that question had we not talk to the other stakeholders in the space that we were looking to legislate in. So we teach young people on how to build those partners and how to consult counsel from the legislature early in the process, how to talk to consultants from different policy committees in the legislature. Every bill has to go through usually 1 to 2 committees to based on the issue that it's most relevant to. So we teach them how to meet with those people early in the process, and also how to balance like the policy language that like and jargon that might be used in those conversations with like the grounded personal narrative that they're coming into the space with, and also how to build a coalition of partners. Like I said, building a coalition of partners, especially given the institutional complexity of healthcare. So reflecting those interests early in the messaging and in the policy, actual policy intervention can really help anticipate some of the later hurdles you might face. And I also think it helps combat some of the general siloing we see in the mental health space where you pit certain interest groups against one another when really like at the end of the day, like there is opportunity and room to create good policy that like most stakeholders can agree with. And finally, like on the more advocacy organizing side, we teach students on how to um, actually do the advocacy and how to push once you get that past that initial hurdle of introducing a bill or a policy. We teach them on how to um, get that through the legislature. So different lobbying and advocacy tactics, the writing letters to lawmakers, having stories for news agencies, writing floor alerts, tracking important hearing dates, and organizing around those. This first image is an image of a Teen Vogue article that we had go out right as we introduced our resolution in Congress. And that was really helpful in getting our narrative out there in a major news outlet that other peers would read early. And then the second is like a petition that we did that ended up reaching 50,000 signatures across the country around how to best support survivors of child sexual abuse. And it ended up, having a petition of that size ended up being cited in a lot of like congressional hearings around child safety and supporting survivors, which obviously is a great way to platform youth voice. I don't know why there's a photo of me. Sometimes it's a jump scare to see a photo of me just pop up on the screen. But hearings, like platforming your voice in hearing rooms. So when most bills will have a hearing if they go through committee. And the hearing is a really great way for you to amplify your story in a public way. And get not only like push the bill forward through the legislature, but also get others in the public interested in your cause and build a coalition of allies. And also like writing letters of support, building solidarity, and demonstrating the impact of your advocacy across different communities. Making phone calls to the legislature, how to organize effectively beyond petitioning, empowering community members to pick up the phone and call their lawmakers. The use of social media to raise awareness on local issues, and also connecting again with more members of the public that can support your cause. And then finally, like the press, it's very, very important for us to focus on the news and the news cycle and the press to ensure that, like, when we are focusing on policy work, that we're centering the right narrative. It's very easy with like mental health policy and healthcare in general to focus on to get bogged down in the weeds of economic debates or very, very nitty gritty statutory issues. So it's helpful for us if we feel, or it's helpful for us to empower young people and their voice by getting ahead of that and making sure that they're able to tell their story and explain why they're pursuing the policy in the first place. Yeah, I think that's kind of covers a lot of the legislative stuff. We also focus a lot on empowering youth voice in direct program delivery and service delivery and like the more like lowercase p policy space. So, and it really utilizing the power of peer and like the framing of trust and distrust in this space as well. So generally, like we focus a lot on figuring out how can we get more young people to co-govern like programs, co-govern in their schools, but also co-govern local health programs as well. And obviously, this boils down to and understanding that youth empowerment, when it's done effectively, involves effective inclusion and legitimate representation. Oftentimes, young people are brought in, for example, way too late in the process. They're brought in to check something off, and that isn't exactly the best form of co-governance in terms of actually creating an effective use, one, of the young person's time, but two, to actually like use their feedback in a place that's helpful. So, providing a voice to young people from start to finish, being intentional about youth empowerment, making sure that there's actually a way to incorporate their input in the final outcome. Far too often, like policymakers will maybe run by a young person, hey, is this a good idea? It's going to get signed into law tomorrow, but just wanted to make sure it's a good idea. If the young person says no, is there any way for you to incorporate that into the final outcome? Probably not. And the same thing oftentimes applies to service delivery. And sustainable, you want to make sure that you're providing attitudinal and financial support to sustain the young person's engagement. A lot of young people, they're willing to provide their time voluntarily, but it can be really meaningful to be able to, if you're asking for a lot of their effort, to provide some kind of financial support or otherwise like a demonstration that you value that their effort and the amount of labor that they might be putting into providing you with that input. And also like legitimate representation kind of ties back to what I was saying earlier, like recognizing that young people have unique expertise on their own and that their lived experience enough is qualification to engage. The best feedback you're going to get on something is just hearing from the people that are using it. And so this is one way of measuring that. I'm acknowledging that like young people are able to create powerful solutions to respond to those needs. If you're facing a problem, you're going to try to find a way to solve it. And so trusting that they also can come up with solutions is really important. So that said, what does it not look like? Obviously, unsustainable requests for contribution, asking students to take time off without support, devaluing their limits and boundaries, saying that, oh, like I don't expect you to know this, like very subtle things that like you might say or do that might make it seem like, hey, like their contribution is not valued. And that kind of ties into this whole piece around implicit and explicit bias. We see a lot of the times that young people are involved in boards, especially like actual governing boards and that's a really great way to like co-govern with youth to have a youth representative. But it's also implicitly like devaluing their time if you invite them to a board where they have no vote. So a lot of times we'll see like a young person is added to this board to govern like a program, but they're given an advisory vote. So they can like say what they would vote, but their vote won't count towards the final tally. That is the one really good, really big example of like, and honestly, an explicit bias against like that student input. And it is pretty depreciative. Like students do feel that, and they do it is something that might deter you from finding the right representation from the student body in general. And also ineffective inclusion, tokenizing students, reducing their contributions solely to what they express as their lived experience, and not recognizing that they might also carry the lived experiences of their peers, asking too late, and replacing like their ability to ideate with like busy work. Like for example, only relying on students to fill out surveys, but not actually bringing in people in to have conversation and to talk beyond the metrics that you've espoused through those surveys. Next, I think like one really key way that we can use policy and co-governance together is by understanding how to measure what matters. Traditional program evaluation sometimes like it overwhelmingly focuses on clinical outcomes and cost effectiveness, but young people oftentimes measure the success of a program entirely differently. So I'll give an example. Like a lot of higher education institutions, like they try to achieve a 1 to 1,000 student to counselor ratio. And obviously, like the ability to meet that kind of ratio is a huge milestone given the workforce shortage that we're in. But if you ask a university if they think that their program is successful, they might say, yeah, I think it's successful. We have a 1 to 500 counselor to student ratio, and we have a 70% utilization rate of our services among students, which I think is successful. And you talk to students and they're like, well, I had to wait 3 months to get an appointment, and I also never got my paperwork for my accommodations in time. They're looking at completely different measures of success. And so then from that perspective, you can kind of understand where some of these gaps might arise if you're looking at the wrong measures or misaligned measures of success. So understanding that young people can play a really good role in program evaluation. And they can define dimensions for understanding program efficacy. And a lot of these things might be qualitative and not quantitative. Like this can be the sentiment of feeling heard and understood by your providers. They can be this feeling of agency in their own care, this connection to community, just generally like practical life improvements and like cultural responsiveness and identity affirmation. These are oftentimes measures that aren't surfaced as much in traditional program evaluations. And otherwise, like incorporating youth voice within program outreach design is also incredibly important. So understanding that like the marketing of the program um, is very important to have youth voice in, because you can create the best program ever, but if young people don't believe in it, and if they don't receive it well, they're not going to use it. The storytelling and sharing of lived experience, creating very vocal and public feedback loops between young people and policymakers, and being very intentional about how you're doing outreach and engaging youth. So generally, like in terms of like we oftentimes work with young people to push like a few different state level opportunities across different states that can be really great ways to capture a lot of this. One is like contracting requirements, so making sure that young people are in, like youth involvement in program design is required in funding for like state or federal programs. Prioritizing proposals that demonstrate co-design with youth or including youth satisfaction and engagement metrics in program evaluation generally and having better quality standards, even supporting training for providers on youth engagement and design, and also like funding sustained youth advisory councils instead of one-off consultations. On the reach side, it's super. It's this is a great way to engage young people and something that they are generally like very good at. Is also being able to relate some of these larger, lofty policy issues to like the issues of and language and rhetoric of their generation of their peers. So relating both the framing and the face of outreach materials to students, you're much more likely to click on a video of someone that looks like you. Like if I am scrolling through social media and I see a PSA, if it's another young person, I feel like I'd be much more likely to click on it than if it was someone else. So utilizing that or with that understanding, like ensuring that you can also include young people in the face as faces of like program outreach is really important. And also, like I was saying before, leveraging entities that students trust, creating buy-in in faith-based communities or clubs or affinity and identity groups. You don't have to reinvent the wheel and like, completely redesign government to suddenly be successful and or not successful, I guess, trustworthy amongst young people, but making sure that you're creating like high impact partnerships with groups that young people are already turning to is really important. And also, like the messenger really does matter, especially if you're using online, like digital spaces. In a world where like common platforms are overwhelmed with so much noise, like there's just so much pollution on those platforms, honestly, of content. You want to make sure that you're really utilizing like key features and characteristics that young people will interact with, and that will oftentimes be someone who's relatable, a framing that's relatable, a format that's relatable. So, peer distribution through those entities that young people are already trusting is incredibly important. Oh, my laptop is glitching. Can you all still hear me and see me? I think so.
Yes, we can.
Okay, perfect. I think also understanding, that young people like they want to be enthusiastic about this work too. And understanding that like the role of administrators, the role of collective enthusiasm and energy, something that is received and perceived by young people as well. And that community spaces oftentimes make students feel more valued and cared for over governmental and education systems, but that there are really critical ways to triage for. So I think with this in mind, obviously funding peer outreach positions in community organizations, partnering with trusted community organizations, and investing in youth-led social media digital engagement can be very concrete ways for states, even localities to design policy with youth in mind. And the final piece that I will say is that a lot of young people are creating solutions on their own, and that the actual funding and capital that's being delivered to youth healthcare and health and well-being has really failed to understand youth as leaders and as caregivers in their own right. So currently, like funding, goes to established healthcare systems, it goes to nonprofits, it goes to universities, and a lot of adult-led, long-lasting institutions, which makes sense. But what's missing is that a lot of the times young people are also creating the solutions in their own communities. They're creating the solutions locally. They're creating peer-run programs. They're creating peer community-based initiatives and youth-led organizations. But because of really key structural barriers, they're not able to access that same capital, and that oftentimes disincentivizes them from creating those solutions. Obviously, like we already know, like peer-based support is one of the biggest ways that young people are creating networks and creating or solving for some of the gaps that we see in the mental health space. Young people are running crisis response groups and mutual aid on college campuses. Like most college campuses, large college campuses have like youth-led crisis lines, which is incredible. And they're more utilized than like the local crisis services that are not run by their peers, which is also incredible. Even just like cultural healing practices and identity affirming spaces, the role of those in providing mental health support is incredibly useful, as well as advocacy spaces, expressive arts programs, and general like change making initiatives. The issue is that youth-led initiatives usually can't access traditional funding because of organizational capacity requirements. So even like the requirement for funding being like having 501(c)(3) status or audited financials or like 10 years of operation, that's just not something that's doable for most of these kinds of youth-led solutions. Or even adult supervision mandates that might undermine youth leadership, or like the clinical credentials that might be required for mental health funding, and complex application processes that are designed for established institutions. Um, and there's also a lot of risk averse funding that favors this idea of what is a proven approach over innovation. When, a lot of these proven approaches might also miss the mark because of the issues I was mentioning before around like not having aligned program evaluation practices that are actually truly aligned with how young people are evaluating those programs themselves. So new funding structures can and should look like, youth-led grant programs with more streamlined applications and youth reviewers. If it would be cool if we could see like states and localities sponsor, like fiscally sponsor youth-led solutions, so they don't need to create their own C3 or some of these more legal barriers they're able to overcome. Micro grants for youth initiatives or youth social entrepreneurship funding. But appreciate you all taking the time to listen to my presentation and hear me talk for an hour. And I'm happy to answer any questions.
Thank you so much, Saanvi. This was a really great and very inspiring presentation, and we have a lot of positive feedback. Um, yeah, please feel free to put questions in the chat or comments. You're also welcome to unmute and if you want to, or request to unmute, if you want to share something aloud, please feel free to do that.
Yeah, I saw one question from Claire. What are some of the biggest barriers you've seen in legislation with youth advocacy? I think one of the biggest barriers that we've seen, there's a couple. One is like burnout amongst young advocates, especially given that a lot of policy change does require time and like it requires several years of sustained effort sometimes. And just the high turnover rate of youth advocates who age out of demographic view are kind of representing. That's why it gets really important to create more community-based organizations and have more structural supports that there can be, a pipeline of youth leaders that can take the mantle forward and continue to engage in that issue. And also one issue that we see with that is that every few years, young people will feel like they're starting over on that issue, and just it becomes a very iterative and but repetitive. And that is something that we have that that you know inspired the Youth Power Project also in itself to be created as a space for young people to have like a little bit more long lasting infrastructure to support their work. And also to be able to pass that down. So that's one of the biggest barriers that we see. And then also the attitudinal burden and that might take on you as a young person. And something that didn't include in this presentation, but that we also do, that we include when we train youth is like helping them understand how to set boundaries with their work. Because when you are working on something that is out of your own personal lived experience, it can be incredibly taxing and can be re-traumatizing based on what you've gone through. And so I'm helping them understand when it's okay to take a step back and like that it's okay to not always tell your story if you don't want to, and how to like not fall into that cycle of tokenizing yourself is really important at combating burnout. So I think those are the two big things that we see. And one last small thing that we've noticed is that over time, like I think young people, I think that over time, young people have gotten more and more used to instant gratification, like in general in life. Like, you're able to access so many things so much more instantly. And policy is unfortunately not one of those issues that has kept up with like instant change. And that's honestly usually a good thing. It's good to be deliberative about policy. It's good to, um, um, might not see the fruits of your labor immediately. And that is tough for a lot of young people who are, in this day and age, you can order something and it'll be on your doorstep in 2 hours. Like, that can be tough. So just like creating community spaces and creating community between youth organizers so they can talk to each other and share that has been useful in supporting. Yeah, I saw a question about is there an out I am if or will we be able to get the slides? Yeah, absolutely. I'm totally happy to share these slides. So I don't know how best to get them to you because my laptop is still bugging out. I don't know what happened. I'm so sorry, y'all. But I'll maybe send them to you, Shira, and then we can distribute it to everybody else.
Absolutely. Yeah, feel free to do that.
Okay, awesome. And then another question is there an outline or training that you have that gives even more detail or information for this outstanding advocacy work you are doing? Well, thank you for uh, calling it outstanding. Um, we have a website. It doesn't have all the resources that we kind of like really dive into with young people, but we do have some training modules, some public like open source like resources like appendices that we share with young people. So I can include that in what I said over to you, Shira. If my laptop decides to open, I can find it and put it in the chat. But yeah, we definitely have more, and all of it we're happy to share. Yeah, I'm also happy to just put my email down in case like things come up. Like, please reach out and like always happy to just support or I don't know if I can ever be helpful. Um, yeah, Michelle, I'd love to learn more. OYCR, are you? Yes. We haven't talked to them before. I have, I think I'm on their mailing list for a couple of things. So I'm aware of some of their work, but um, a lot of our mental health focus is actually really focused on like a decarceral approach to youth mental health care. So, um, yeah, I mean, if you think they're a good person, good group for us to talk to, I'll definitely keep that in mind. Yes, please. Yeah, I'll just put my email in one more time. And please like feel free to reach out. Yeah, I'm so grateful for all of your guys' support in general. So appreciate the positive comments a lot. That's really kind.
We're getting a lot of positive feedback. Thank you so much for this. Um, yeah, I'm just gonna give people a minute more if anyone else has questions that you want to put in the chat or comments. Um, or if anyone wants to share anything out loud, you're welcome to raise your hand or ask to unmute, and I'll just give it like a few more moments to see if anyone has anything you want to share or add.
Yeah, and thank you all for having me. I really appreciate this moment to share about what we've been doing.
Thank you so much for the presentation. This was awesome. Thank you so much, everyone, for coming. Um, we will be sending out the recording and the slides and a certificate of attendance, so please stay tuned for that. We also do have an upcoming coffee house that we'll be sending out information on. So please stay tuned for upcoming events. But um, I guess since there are no more questions, we can go ahead and end today's webinar early. Thank you so much, Saanvi, for your presentation. And I hope you all have a great rest of your day and look forward to seeing you at our next event. Bye, everybody.